Hello and welcome to this new episode, the second one this week already, of Mind Explorations. And today, again, for the Chicago Hypnosis Conference on the 17th to the 18th of October this year, 2025. I have two guests today, and that would be Cormac Colleran and Jodie Solberg, Dr. Jodie Solberg. And they're going to talk about hypnotherapy for addiction. And they've got a very brand new approach to work with addiction. So first of all, welcome both of you. Nice to meet you. And Cormac,
Thank you.
welcoming you back because you have introduced to us the ICANN protocol before.
Hmm.
And that was about half a year ago.
Yeah,
Yeah,
February, I
about
think.
half a year ago. Yeah, before the Dublin conference. But this is brand new. So keep watching. You haven't seen this before. So first of all, let us have you introduce yourselves. So Jodie, you go first, ladies first.
Okay.
Where are you from and what do you do?
So I'm from the United States. I'm from halfway between Seattle and Vancouver, Canada. So I'm up on the US Canadian border, beautiful mountains. And I have been a hypnotherapist since 2001. My background is in social and clinical psychology. So I actually became a hypnotherapist while I was in grad school for clinical psychology. And I was just fortunate enough to have a professor that was a hypnotherapist, and we had a hypnotherapy school right next to us that taught clinical and medical hypnosis. And so that's how I originally got certified because I wanted to be able to help people get results faster instead of
Mhm.
just talking in circles around their problems and reinforcing them for years on end. I
Yeah.
wanted people to be able to get real results. So that was my focus there. And I've always worked in the field of trauma. So when I started my career, it was around, custody and abuse cases with families, for example. And then I moved into about 10 years where I worked almost exclusively with people who were dealing with drug and alcohol convictions and addictions. I've also worked with all ages, so children, teens and after school programs and group homes. And I do a lot of trauma and anxiety work for families, whether it's around pregnancy or divorces, different transitions, things of that nature. And so then let's see, it was 2018 going into 2019. I started my private practice. I was doing coaching on the side. And what I found is keeping my therapy and my coaching world separate is that there were a whole lot of people in my coaching world that really couldn't figure out how to get themselves to do the things they knew they needed to do from the coaching because they
Mhm.
had these subconscious blocks and barriers. And I thought, I know how to help them, but I'm not their therapist. And so I decided to start my private practice then and really help people holistically as whole people. And so to bring that trauma informed approach in and work with people through all the different modalities through coaching and hypnotherapy and NLP and everything that I had learned over the years. And then I started speaking and training and writing over the pandemic.
Mhm.
And then here I am today. So that was my journey and how you find me here now.
Wonderful. And Cormac, we've met you before, of course, and you're in Dublin. So tell us again, though, for those people who haven't met you yet and haven't seen you yet on the other show.
Yes, so I run Dublin Hypnosis Clinic in Dublin. I've been a practicing hypnotherapist for about 15 years. My educational background is in business and psychology. And so, like Jodie, I started out in the coaching world.
Mhm.
And my transition into hypnotherapy was the same thing there that Jodie was talking about, working with clients, um, setting out a path for them to follow and then noticing that some people just weren't doing it. And so I started to study hypnotherapy in order to become a better coach, in order to
Mhm.
understand what's happening in here. How do we set up blocks? How do we run patterns that aren't serving us? Um, and yeah, I guess, like most of us here, the hypnotherapy bug bit. And so I got more and more into it and just enjoyed it so much that I then transitioned from calling myself a coach to calling myself a hypnotherapist.
Mhm.
Um, I've also been running training a number of years. I think I started just around this maybe 2019, around the start of the pandemic. Um, With regards to why Jodie and I are here together,
That would be my next question, yes.
yes. So Jodie and I met at the Heartlands conference in St. Louis, Missouri,
Hmm.
back in April. We are both element trainers, and so Cheryl kind of brought us together. So I heard Jodie speaking at her talks. She heard me speaking. We spoke afterwards together, and we realized that a lot of what we were saying was there was a lot of complementary areas.
Hmm.
And so my whole approach to working with addiction, really to working with anything after it, any issues, is very much solution focused. We heard Jodie talk a while ago about clients not wanting to be, looking at the problem from many different angles. I'd be the same as that. It's solution focused. It's where they're right now, where they need to be, and what's the quickest way of getting there. Um, so one of the things that I realized is I had settled in on some really strong protocols and methods for helping clients to drop old habits, to drop addictions, to drop patterns that aren't serving them anymore.
Hmm.
Where Jodie came in and what she was speaking about was the trauma-informed side. So there's maybe the surface level might be the addiction pops up. I use the whack-a-mole analogy.
Yeah.
So
Hmm.
that we can help someone with an addiction. We whack the thing and that addiction is gone, but maybe it pops up somewhere else in a
Hmm.
different form, in a different guise. So what's beneath it is that trauma.
Hmm.
And so there's where we need to go really to have lasting change. So there's getting rid of the habit or the addiction, but then there's resolving like what creates it in the first place.
Yeah.
And so Jodie has said she spent most of her career focused on that trauma-informed side. Um, so we got to talking about like what we could bring together. And I was running training in Dublin back in late May, and I invited Jodie over just to see was there an appetite for this. And so I was running a training on cocaine addiction.
Hmm.
And so I gave Jodie some time to bring one of her modules into it. And the feedback was great. People wanted more of it. And we realized we were onto something then. And
Right.
so, yeah, so that's
So,
together solution focused and trauma informed.
okay, so solution focused and trauma informed. Can you describe how that works in rough lines? So the client comes in and they have a problem, and what do you do then as the following steps? Do you know
So
what I mean? Like the
yeah,
the
Yes.
yeah.
right. So I will do. I've like we have a number of protocols that I use. I mean, I introduced the ICANN method back 6 months ago. There are a number of other ones about breaking the client out of the addictive trance state. So we're still bringing that solution focused approach,
Hmm.
but also with the trauma informed approach, it's kind of cleaning it out at the roots. So it's
Hmm.
getting beneath that surface. But what actually we've noticed happening is a client will come to us with an issue and their issue is where it surfaces in their life, where it manifests maybe into an addiction, an unwanted behavior. But what they're not realizing is that the roots of it are something else. And
Hmm.
so when we now work bringing the trauma informed and solution focused, bringing the two of these together, what we notice is that we're actually having to change their lives, not just resolve the addiction. So
Yeah.
they're getting a whole lot more from us than they ever thought they would.
Hmm.
And now they're also, our clients are out there just speaking about us. They're getting um, just far more than they expected
Yeah.
because they might not have put two and two together that what's causing it at a deeper level.
Hmm. No, that's actually how I work with tinnitus clients because that's only a symptom as well. So it's probably a very similar approach. But tell me, what are the usual common threads for your clients, the deeper lying trauma that they have? Is there any common thread, or is it any type and kind of trauma that they've experienced in their life?
It could be such a wide range, honestly. Sometimes You'll see some common things. Just with the types of clients that we see, for example, me personally, when I work with, women who've been in abusive relationships, often I'll see things like negative self-talk that really wasn't their own. And so we start working on that of, whose voice is that? And how do we switch that and really reconnect with themselves and learn how to trust themselves? So I may see with certain populations of clients, but honestly, it just is such a wide range. I know Cormac has a really good example of a client that he saw pretty recently within the last 6 months where, she had no idea what that root cause was. She had come in, and you can add more to this, Cormac, since it was your client, but she had come in for smoking and he helped her to stop smoking. Great.
Yeah.
And then months later, she rang him up and said, hey, now I'm eating a lot of sugar and starting to gain weight. And I've really, now what she's essentially saying is I'm replacing one habit for another habit. And so he had her come back in and started working with her and figured out what that underlying trauma was. But often what I find is that it is rooted in childhood a lot of the times. So I would say that could be a common thread. And it's often things that they wouldn't have even thought would either be what they would consider traumatic or a big enough deal, because a lot of times we're taught to just try to push through, get over it, move on. It shouldn't be that big of a deal if it's not this huge catastrophic event. Often with trauma, it's not just these big events that somebody would think would be, what we call big T traumatic, but it's something that's maybe underlying over a period of time, or something that is internalized as a child to be much more impactful.
Yeah.
Somebody can go through exactly the same experience and have a different nervous system reaction, have a different experience with it. For one person, they may be able to process, release it, and move on. And for somebody else, they, create this subconscious coping strategy for it where they don't process it, they don't move through it, and it carries with them. But Cormac, do you want to finish that story and talk about what that underlying trauma was for your client?
Sure, yeah. Like we notice that like coping strategies, this is what like addictions tend to be. Either coping, escape, connection. And this client in particular that Jodie mentioned did come to me to help her quit smoking, and I helped her quit smoking. A number of months later, she came back. She was eating a lot of sugary foods, and through a little bit of exploration work with her, we found a memory of when she was 6 years of age, and so a little bit of the background, she did have an older brother, um, with a severe form of autism that had violent tendencies. So she grew
Oh,
up being frightened by her older brother. He was bigger than her. He did push her in the open fire. He would hit her, and so her parents had to spend an awful lot of their time and focus, especially her mom,
yeah.
on her older brother.
Mm.
And so at 6 years of age, she fell out of a tree. She hurt herself. Now, I've got a 6-year-old daughter, and if she fell out of a tree and hurt herself, I'd know about it. She'd
Yeah.
call for me. And I know you're a mom yourself, Astrid, you know that.
Yeah.
And so this lady, she's probably about 56 now. So at that age, at 6, she fell out of the tree. She was going to cry and call for mom. She realized that it was going to be pointless. And instead, she went
Right.
to the biscuit tin
To get comfort.
and get comfort.
Right. Mm.
And she told me in that year alone, she put up about 3 stone weight. That's like 45, 50 pounds.
Yeah.
A 6-year-old girl.
At 6 years old.
Yeah.
Mhm.
So
Yeah.
she
Okay.
learned that as her comfort. She learned that as her coping strategy.
Mm.
And so that was her way of dealing with things. And so when the
Mm.
subconscious mind learns a pattern like that, it tends to hold on to it. And
Yeah.
so it comes up in our lives at different times. People put up weight, lose weight, put up weight, lose weight. And it's like what I do is help to remove it at the roots, the pattern. So we look at the underlying pattern. What's behind that? And so there was this pattern that's not serving anymore, and the pattern was going to food, to comfort.
Mhm.
And we see this with emotional eating clients all the time. And so when we can help to share them with our client what's actually happening, and then help to remove those those patterns at the roots, it's like someone will go on a diet, someone will lose weight, but if the roots are still there, it's like if I go over my lawn with the lawnmower, I can
Mhm.
cut the weeds and it looks like they're gone. But eventually, if the roots are there, it comes back up
Yeah.
in some form again. And we're looking to remove it at the roots and then really begin to release that trauma so that it's not popping up in any other way. And
Right. Mhm.
yeah,
Go
so
ahead.
these are things that we see. Like that's just one example. We see common threads that addiction shows up in different forms, and it's
Mhm.
all this kind of quest to escape or connect, um, or to just change how we feel in a certain any given moment.
Yeah. So what
Exactly.
kind? Go ahead,
Okay.
Jodie. No,
I was
you
just
go
going to say,
ahead.
yeah, the red is more about, less the exact trauma and more about that there was something, that there was a coping strategy, a
Yeah.
solution in that moment subconsciously that, did serve them for, whatever that positive intention was, but then it became something that wasn't serving and supporting them anymore. And
Mhm.
so when we figure that out, what that is, and pull that out by the root, then we can replace that, with
Mhm.
more fertile soil, something that's going to serve and support them better and help them find an alternative solution that isn't going to be harmful.
Okay, so that sounds very much like parts.
That's part of it. Yeah.
Yeah.
So we have our
So,
own spin on some parts work. Yeah. Because there's always,
mm,
that part of them that wants to
mm,
change. And,
mm,
when they're coming to us, there's going to be that part of them who's
mm.
wanting to, have a different life, to be able to, have those healthy relationships or their healthy eating habits, or to, stop smoking or whatever it is. But then there's that part of them that's resisting or sabotaging that effort because it's serving a purpose, and it
Yeah.
still believes that it's serving a positive purpose, even though it's now being detrimental in their lives. And
Mm,
so that is one piece of what we do, is that parts work. Absolutely.
right. So, I mean, I was just hearing root, so that automatically brings me to the idea, do you use regression as well, or is that something different that you do if you want
I
to
do.
remove the root?
Yes.
Yeah.
Yes. As needed. So we can do, some regression if needed. We can do some inner child and some parts work. Cormac has a really wonderful uh, unconditional love and acceptance of self
Hmm.
process, that's really, really helpful for that as well. In resolving that, once you figure out what that root is, being able to integrate those parts and then fully embrace
Hmm.
themselves and be able to move forward. So there's multiple pieces to that, just depending. And the work that we do is very client centered. So it depends for each person on what's coming up for them, and really
Hmm.
meeting them where they're at in that moment. So that piece for what we do is a little more interactive, as far as seeing what is coming up for the client. Do they have things that are unresolved from childhood? We need to do some regression or some inner child work around. I incorporate the inner child work into the unconditional love and acceptance. I think that's really important. And then, is that something where we need to dig deeper? Often, with Cormac's, processes, you don't always have to. It depends. When
Hmm.
he helped her quit smoking, if that had been it, wonderful. Not
Yeah.
everybody needs to go a little bit deeper. So we have a 3 to 5 session protocol,
Hmm.
depending on what's coming up for the client,
Yeah.
is going to, tell you which direction to go, and if you need to weave in some more of those pieces like regression.
Hmm. So can I imagine that like a family tree kind of? So client comes in, you do your first set, and then you go whichever branch you need to go down. Is
Yeah.
that
Mm-hmm.
correct?
And what we notice, like with regards to the regression, and sometimes like getting back and pinpointing, as Dave Ellman called it, um, can be very powerful and very helpful. We also know that the subconscious mind knows the roots of the pattern it's running. It knows the
Hmm.
triggers. It knows why it's running the patterns. So we can work with that subconscious mind outside of regression and get
Hmm.
it to to just go in and go to the roots and remove and release. And I've been doing that kind of stuff for years, without actually necessarily regressing back to an initial sensitizing event. We can know that there are some, and that the unconscious mind knows it. And just if we can create an appropriate enough level of trance, that we can put the unconscious mind to work on doing that stuff beyond our awareness, of course.
So basically content free. They don't have to know what happened.
They don't have to know
Yeah.
exactly.
They don't always have to go back
Yeah.
there.
Okay, so a 3 to 5 session protocol. Can you go through those just like on the surface? We don't want to give away too much because I know you've got a training, and you don't want to give away too much. So
Yeah, so typically, I mean, the first session we're actually getting an understanding of what the issue is with the client. So if they say they come with an anxiety or an addiction, getting an understanding of, like, we're always interested in what's happening at the subconscious level. So they're interested in how it manifests at the surface. We're wondering, okay, what's happening at the subconscious level? What's the pattern that the unconscious mind is running? What's the potential secondary gains? What's the purpose of the part that's responsible for the unwanted habit? So that we can acknowledge that part, we can work with that part. A lot of this then is sharing and understanding with the client, because well, really what it does, it primes them for the change when we go into the actual hypnosis part of it after. So you're priming them and you're educating them. And because we know their conscious mind does want to know a bit of what's going on too. And so what I notice is that before we go into hypnosis at all, you can see things clicking, you can see things turning. And we've a few nice clever reframes that really take the weight off the shoulders of our client, and take the shame and guilt out of whether it's anxieties or addictions, whatever that might be. So then we're going into, we're working on the different parts. We're working on the ICANN protocol. Over the number of sessions, we're breaking that trance state. We're putting them into that position. So you're about to like line up that cocaine and sniff it. We put them into that like space where they don't feel they're in control.
yeah,
And then rather than it following the same route, we can pause things down and give them a different route. So instead of the trigger always leading to the same outcome, the trigger response mechanism, we can have the trigger lead to a different outcome, and we can practice that in their minds,
right.
and create a new neural pathway. So over the sessions, we're bringing these different tools in, and then there's and also the trauma-informed part where it's about releasing that kind of negative energy. In fact, Jodie can speak a little bit more to that. She's the expert there.
Yes, absolutely. So just like Cormac has his I can method, I have my restore process. And so that's where we transition to that process. And part of that is to regulate. So helping them to establish safety and presence in their nervous system to feel more connected, because often our clients are very disconnected. So we work a lot on that mind body kind of reconnection piece that we're remembering, and then exploring, creating a peaceful and a safety in an inner world for subconscious exploration. So again, their subconscious can be doing that work for them, and then really tuning into their internal experiences. I create a lot of things like empowerment symbols, things like that, inner tools and resources that can support them in that healing work. And then helping them really reframe and reshape those internal experiences. And, that's where we're talking about things like, potentially, if needed, we can do some of that inner child work or chair therapy type of work, or core transformation, for example, and then really stepping into their new identity, right? Who they're becoming, these new beliefs. And, I do a process where they become their own role model, and we can do things like future pacing there. And just, really wrapping it up with reinforcing that safety and empowerment. I like to give practical integration tools and things to implement, things that they can continue the work, their subconscious. I always prompt them that their subconscious will be continuing that work. And they also are going to have things that they can be doing on that conscious level, especially to slow down that process with their nervous system activation. You know, our emotional system in our brains moves about 4 times faster than the thinking part. And so helping them to slow that down and to hit that pause button so that when they do feel triggered, activated, for example, then they have tools, they have resources to regulate themselves, getting them back into, in psychology, we call it like a window of tolerance or window of capacity. My clients have always dubbed it the window of okayness, you know, so you can feel like, I've got this, I can handle this, everything's figure outable, you know, helping them because, you know, when somebody has had a history of trauma, whether, you know, it was something that they really realized or it was something that was below the surface that they is just now coming to their awareness, often there's things that dysregulate them on a regular basis. And so I want to make sure that they're equipped with those tools, both conscious and subconscious, to help them that are going to serve them, you know, for the rest of their lives, that they're going to be able to resolve and move forward. You know, and that's where it's important, yes, to be trauma informed, but also still really solution focused, because that's our goal. Our goal is not to take them back and keep them there. You know, our goal is to really help them to move forward so that it's not whack-a-mole anymore, you know, that they're not having these things pop up somewhere else, that we're able to, you know, equip them and empower them to take care of themselves moving forward.
Jodie, you used the word identity there, and I think it's a very powerful thing, and I think it's a great thing that us as therapists really can be doing with our clients, that like we're attaching them to a new identity. So it's not just like I've stopped smoking, but who am I becoming by doing this? What's the real choice I'm making? A client never comes to us to quit smoking. They come to us for a bigger choice. Like if cigarettes weren't bad for them, they might not be coming to us at all. So really coming, and we need to help our clients every single time understand the real choice that they're making. And the real choice that a smoker comes is, I'm choosing my quality of life. I'm choosing my future. I'm choosing how I want that to be. So now we're not losing something anymore. We're going after something. And when we can attach a sense of acceptance to the decision, and we lock in a sense of acceptance to that decision. So it's not just acceptance that I'm not smoking anymore. It's acceptance of who I want to be. The choice I'm making, and then begin to attach that to someone's identity. And so now it's like, you know, see the person that you want to be becoming and step into that person and step into that role and step into that life. You know, we know it can be a very powerful thing for people to like integrate a new way of being at that identity level. And of course, with hypnosis, we've got many different ways that we can do that and help clients to achieve that.
Much easier, yeah. But how much resistance do you normally experience in clients? I mean, I know some cases where you just know they don't actually want the change, or they're worried to step out of their comfort zone into that new identity. So how do you work with that? Or how much do you experience in that way?
Here's one of the questions I ask. Like oftentimes when I work with someone with cocaine addiction and they're telling me about like problems or telling me about like their escapades, and you can see them going into like pleasure in their mind, and we don't want them attaching pleasure to it. And so rather than asking why quit, we need to reframe it and say, why not stay doing it? It seems like you're enjoying it. So then it puts on them. Now they've got to tell you why they want to stop. So we said, well, why be here? Why not just stay doing it? Then they need to tell us, because there can be resistance, but they might not know they're resisting. And it's up to us as seasoned hypnotherapists, and it's up to us as their therapists to recognize these things in them. And you know, I always say, it's never our job as a hypnotherapist to convince someone to stop a behavior. That's not our job at all. They need to be convinced that they want to do it. Then we help them to do that. And if we're telling them like smoking is bad for you, you shouldn't be doing this, so many people die, so many people, they don't need that from us.
They know that,
That creates resistance itself. And it can create a feeling of like being judged, of which breaks rapport. So
Yeah.
we need to really understand these things. Um, and you know, we're not there to convince them, we're there to help them. Now, it
Mm.
may be that we need to use a few clever reframes to bring them back into the reason that they're coming to us.
Yeah.
Um, so sometimes then, I mean, with the question around resistance, sometimes, you know, I notice it coming up in things like pain control.
Mm.
Person fights hard to hold on to their pain and they've no idea they're doing it.
Yeah.
And so we've got to start looking for, well, what's the secondary gain? Like, what are they getting from this? And oftentimes it's something like a sense of attention or love. I worked with a client before that told me the only time in her life that she felt love from her mom was when she broke her arm and she was going to the hospital with just her and her mom. She was from a big family and
Right.
she felt it then. So her unconscious mind decided, I need to have something wrong with me in order to feel love.
Yeah.
And so
It's
she
good. Yeah.
went through decades of life having illnesses and back pain and all sorts of different things. And it was a real aha moment for her to realize this. Now, it's not that we just said to them, you're creating this pain because you want to have love and connection. We can't say it, as you know, we can't say it straight out like that. So we got to find ways of helping them understand.
Mm. Yeah, they need to come up with the idea, with the knowledge of what is going on.
Yeah.
You can't, yeah. Mm.
Yeah. And when they do then, and something clicks inside, then the resistance drops away. They realize
Right.
that they were doing something. We say
Mm.
to a client, I say, I always do this. I pick up my glass of water and put it down, pick up my pen and put it down, and I tell them that's a thing. I tell them then a feeling like anxiety isn't a thing.
Mm.
It's an action, it's a verb. It's not something that you have, it's something that you do.
Yeah.
You actively do it unconsciously. And we typically do it in three ways. We do it through our thoughts, we do it with our inner voice, what's the narrative that's going along with those
Mm.
thoughts, and we do it with our body. Where am I holding tension?
Yeah.
And again, when a client gets this, and they realize, I'm complicit in it. It's not an outside force acting upon me. If it was, I'd be a victim. There's nothing I could do.
Mm.
When they understand that it's actually something that they're doing, they're complicit in, now they become immediately empowered.
Yeah.
Because they can
Empowerment. I was just going to say that you empower your clients as well as taking the fear away from them that there's something they're going to miss if they step into their new identity. Correct?
Exactly. Yeah, it's so important to help them not feel like you're just taking something away from them.
Yeah.
Because often, like you said, then that causes that resistance. And so we're looking at, how is getting rid of that behavior beneficial and detrimental, but also how is having it beneficial and detrimental right now? Because often they'll just think, oh, it's all bad. But there's something that it's doing for you. I similarly to that pain client that Cormac was talking about, had a migraine client. She'd had bad migraines ever since she was a child. They had done every test under the sun on her, and so they really didn't know why she was having them. She was just going to have to live with it. Now she was a mom herself, and we were doing this work together, and she figured out there was just an unbelievable amount of pressure and expectation put on her as a child to achieve and to perform. And even now, as a mom and as a business owner, she subconsciously was feeling like the only way she could ever get a break
was to have
a migraine and
Yeah.
have to go in to, the bedroom in the dark by herself. It was the only time she could rest. And so, when we can figure out how is that actually serving you, we can figure out how they can then give that to themselves. And often if it was something from childhood, we can teach them how to give themselves what they didn't get, because it's not just about things that happen that shouldn't have. Sometimes it's things that should have happened that they didn't get that support, they didn't get that unconditional love and acceptance when they weren't sick, or when they weren't performing and achieving and getting straight A's or whatever it was. And so I think it is really important, like you were both just saying, to you'll make sure that you are giving them something that they can step into and they can feel good about, so that subconscious doesn't just put those walls and barriers up and say, nope, I'm not doing this. The other thing too, Astrid, that often I will see resistance around is, that highly critical analytical mind, not wanting to calm down and step aside. So I have a technique for that helps to give it an even more important job, and to step back and gather all the information so that it can then analyze its little heart away later. So I think, that's also something that I pull out whenever needed to. Like I said, live close to Seattle. I work with a lot of engineers and really analytical, technical people. And so, sometimes that will come up too, like, it's hard for me to quiet down that part of my mind. And so, asking that part of their subconscious to step back, observe, take it all in, can be really supportive as well.
Yeah, right. And you were talking about tools that you give your clients. So is that all in the hypnotherapy space? Would you say that like self-hypnosis, or do you use things like breathing, EFT, etc.? What do you do?
Yeah, so I do a number of different somatic tools, and I do some of the somatic, teaching within hypnosis. And then sometimes I'll do it afterwards too. Yeah, we'll do breathing techniques. I have a mindful check-in that I do with my clients where they can bring themselves in. It's a very light state of self-hypnosis for that one, but it's just checking in, because as Cormac had mentioned, with the thoughts and then our physiological responses. So, our thoughts and our self-talk create emotions, which are just physiological responses we put words to, that we name. That's how we know when we're nervous, is our heart rate, our breathing rate, perspiration, flushing, whatever, butterflies, all of those things. That's what people call anxiousness, nervousness, whatever it may be for them. Some people, hold things in their shoulders or their jaw when we're talking about stress. And so I'll help them to really hit that pause button, breathe, bring themselves into a self-hypnotic state, look at what is coming up for me. What are my thoughts? What are my self-talk statements that are coming up? But then what's happening? What am I experiencing? What are those sensations that are happening in my body as well? And then they can learn how to breathe and shift it, reframe that, and then they can move on with their day. So that could be just a really quick, couple minutes, like a 5-minute type of a practice that they could do. But yeah, when it comes to, like you said, all of the tools, whether it's breathing and mindfulness techniques, whether it's things like EFT, self-hypnosis, I'm a fan of whatever is going to help that client. And so I have a lot of different tools in the toolbox, again, based on that individual client and what's happening with them, to help them get into a more regulated state in their nervous system, and then be able to make those empowered choices and be intentional. Often they already are in a hypnotic trance state. Cormac talks about this all the time, of breaking that trance state that they're already in. So teaching them that when they're participating in that pattern, in that habit, that's already what's happening. And so we can be more intentional to choose the other path, the new pathway, versus going down the old one.
I suggest to my clients as well, some of them, addiction clients, mostly the kind of cocaine and men that I work with, the exercise, obviously, it's a big one. And because I do it myself, cold water, so ice plunges.
Oh, yeah. I think I've seen you do that before. Oh,
yeah, yes, he has some videos on that, and I know as women we're like, ooh, a little cold.
Makes me freeze immediately.
Yeah. So it's never necessarily pleasurable being in the water, but when you've gotten out,
I can imagine. Nice and warm.
And you can do that. You can do your whole body. You can do that with your face. There, your hands. There's a lot of nervous system regulation techniques out there that have to do with cold. So there's multiple different ways. We're definitely fans of being able to help people have the positive alternative solution to help them find that, right? Their subconscious, to find that solution that's going to work best for them. So For Cormac, it might be a cold plunge. For us, it might be something else.
Well, so
Right.
the great thing about the cold plunge for me is that, like, so what does it do when we get into ice water? It puts the body into shock. So it mimics like what kind of panic. The heart rate goes up, the breathing shallows, um, and our body is in shock. And what we're looking to do then, just through some breath work, and I follow the Wim Hof method, and and it's just about controlling your breathing.
Hmm.
And so when you're sitting in that ice, you're looking to control your breathing. When you can control your breathing, the heart rate comes back down. And for me, it's just a focus on the out breath. So even if I'm like, we're like, we do that. So when we have even that short intake of breath, then we're looking to do a
Hmm.
really long, slow out breath. And each time that we do that, then what I notice is we start like this, and I notice that I settle into it. And the purpose then is to not to stay in as long as you can, but to stay in to the point that you feel comfortable. When you've
Mhm.
Oh,
gotten to that point where you feel comfortable, then you can get up and get out.
right.
Exactly. Till you
So you've done the
regulate.
work then. Okay.
Mm,
Right.
That elongated exhale
mm,
is what settles that nervous system. And so you put yourself intentionally
Hmm.
into that activated state and then bring yourself down. And then if you can do it in that situation,
yeah.
you're conditioning
You can
yourself
map
to
it.
do it in other
Yeah.
situations.
Yeah. Okay. Maybe it's a good idea to do for a lot of people, except for me.
There you go.
I'm not.
Power
I'll
of
do
choice. That's
anything but cold water. Um, okay. So activated state usually means stress as well. So
Mhm.
how many or how much of a client's issues have to do with stress, with actual stress? Is it just habits more or less, or is there a stress component? Or in how many clients do you have stress components then and anxiety of the addiction clients that you have? So does that make sense?
It does. Yeah. Go ahead, Cormac.
How big a role does stress play in your clients? To make it a simple question.
You want to take
What
that?
would you say, Cormac?
Okay.
And then I'll
Uh,
take it.
yeah, I mean, like it does. I mean, even the fact of having an addiction causes stress.
Mhm.
They're layering on different kinds of stress, shame, guilt. Like there's the addiction, the behavior itself, and then there's the suffering.
Hmm.
The suffering is those extra layers that they're layering on. Also, it the addiction causes stress, and also it's like the chicken and the egg. The stress causes the addiction. So if they're stressed out, they've got meetings at work, if they're feeling overwhelmed, then the person just wants to escape that.
Hmm.
And the addiction is the perfect escape. Because as soon as you open that bottle of wine, you don't have to get drunk. As soon as the bottle is open, the escapism starts there.
Yeah.
Soon
Right.
as they whatever the behavior is, the escapism starts there. So yeah, stress plays quite a big part in it. It's right there in the whole cycle. It's caused by stress and creates stress.
Mm. Right. So, what's your take on that, Jodie? I'm
Yeah.
talking in the wrong way. I can see on the screen, and I'm looking at you now. I'm looking away from you.
Turning back and forth. Yeah. Yeah, absolutely. I completely agree that, it plays a big part, honestly, in pretty much all cases when we're talking about our nervous systems, when we're talking about stress and we're talking about, being in that fight, flight, freeze, fawn, all of those types of activated types of, you know, states that we can be
Mhm.
in, what happens is our nervous systems are constantly scanning for threats. And in our type of modern society, we don't have to be activated by things like lions, tigers, bears, and
Mm.
cars coming at you. It doesn't have to
Yeah.
be a physical threat. It can be a perceived threat. And we
Mhm.
have a lot more stress in our lives and in our world, and a lot more information coming into our brains.
Mhm.
I've read in 30 days, we have more information that's overloading us than our ancestors had in their whole lifetime.
Ooh.
Adds how much information we're constantly processing and dealing with. And so those perceived threats, that could be, things that people are worried about or
Mhm.
anxious about, they're fearful of. It could be things from the past. It could be worries about what's going to happen in the future, or very seldom in the present moment. And we aren't really conditioning ourselves to process and release the way that we're designed to. We were wired and built to be able to do exactly what Cormac was just talking about with that cold plunge, to be able to handle that stress, to be able to process it and release it, to be able to feel that relative sense of safety. So when you get a shock to your system, whether it's internal from those thoughts and the negative self-talk, or it's external, something, somebody else says or does, or, whatever you're responding to around you, we are meant to feel things like a wave and just process and release them and let them go and move on. And we store them. As humans, what we like to do is overthink everything, stuff it in and store it. And so then we're not actually releasing the stress. It's
Yeah.
accumulating. And so when you're talking about addictions and habits, there's those coping strategies for people to deal or not deal. Because often it's like, how can I not deal with this right now? And they get that false sense of relief from whatever that behavior is. So if
Yeah.
it's smoking, or if it's eating or scrolling, or, spending, or whatever it might be, they're getting that temporary kind of dopamine hit, and that, a little bit of feeling okay until it really isn't fun anymore and they don't, but it's just the way they know how to deal with it. And it's never really going away. It's really interesting because when you work with people, let's say with smoking of any kind, so cigarettes, marijuana, vaping, whatever it might be,
Mhm.
half of it is just breathing.
Yeah.
It's the
Yeah.
focus on the breath. So you can actually just teach them, in their bodies, to be able to get that same relief by breathing,
Mhm.
and teaching them, these different breathing techniques that are going to give them a lot of that same relief. And it's stress relief. And a
Yeah.
lot of that is just a new, healthier coping strategy. So yeah, I think stress plays a huge role, because that's just how we're made, is to
Mm.
be able to deal with these things. But our modern day, not exactly what we were wired to have to deal with when it comes to stress.
Yeah. Absolutely. So what's your biggest transformation story of a client that you can recall at the moment? Like the most fascinating one that you can think of.
Um, well, I suppose one that I mentioned earlier, that lady that, fell
Mhm.
out of the tree when she was 6. We were able to work with her to, like, first of all it was the smoking, then it came back with the weight and the sugar and all of that. Um, when she had that realization that, like, this went back to being a 6-year-old child, this went back to, like, a search for comfort, and that the
Mm.
subconscious mind learned, boom, there's a pattern, I'm going to repeat it and repeat it. And when she had that realization, then it opened up the space to release it. And then by working on, like, doing some inner child work with her, helping her go back to that 6-year-old child, and give her the comfort that she needed at the time. Um, like, this is a few months ago that she worked with me. I happen to know she's doing really well. Her weight is coming back down. She's exercising. That's something she hadn't done in a long time. She feels a
Mm.
lot healthier, a lot fitter, a lot more confident. And these are the kind of things that, are happening all the time. Like, I had an awful lot of people overcome things like cocaine addiction, just from,
Yeah.
it's quite rife here in Ireland and in South Dublin. Um, people are getting their lives back. They're getting their weekends back. Their children are getting their dads back for a walk on a Sunday, or,
Mm.
or something to do, rather than the dad being in bed all day and destroyed because he's taken loads of cocaine the night before. These are like, it goes through the family. So, and again, when people realize that, when we remove that kind of deeper trauma, um, that they've just got this sense of freedom, and they
Yeah.
can go on, and, like, I always give my clients the suggestion. Um, I give it to them in waking trance after, when we're finished. I will say to them, don't be surprised now if you notice other improvements happening in your life. Things begin to happen, you know. I just say to them, this is just something that happens. So it's a really nice suggestion for someone to get when they're walking out the door.
Yeah, true.
They'll start
Because they'll be looking for it. They'll go looking for it, and that makes them happen. Yeah,
seek and you shall find, right?
amazing.
Yeah.
Mm,
Yeah, I
wonderful.
had a client that it just always stands out to me because it was such a huge transformation. And she had, known trauma. She'd been abused by a family member as a child, had a narcissistic abusive ex that she was still trying to co-parent with for her toddler. And she was literally spending hours every single day in the bathroom smoking marijuana, trying to just numb. She had chronic pain and health conditions. She really wanted to have another baby, but she couldn't. First, with all of her health issues. Second, with the amount that she was smoking as well. And that was costing her a lot of money in not just the supplies that she needed for her habit, but also doctor bills. And she wasn't able to be the parent that she really wanted to be. And just like Cormac was saying, it's so powerful to help people do that reparenting work on themselves.
Yeah.
And be able to, treat herself the way she wanted to be able to also treat her own child, and to really have that huge transformation where now she's healthy. She isn't, smoking. She's feeling so much better. She was dealing with autoimmune conditions and things of that nature where she had a lot of chronic pain that has alleviated. She's healthy now where she's been able to, she needed to have a surgery in order to be able to have another baby. Her relationships have improved. It's just been such a night and day transformation. And for her, I mean, she would even break down when we first started working together, just even trying to say the words, it's okay to like what I like, or it's okay to, to be herself. She couldn't do it. She would just absolutely break down. And she was so burnt out from being activated constantly in her nervous system. And it's, just really incredible to see her today and where she's at. And so for me, that case always stands out.
Beautiful. Wonderful. So by helping clients change a little habit, maybe you can change their whole lives in the end.
And generations, because you can change, them, but then it's everyone that they come into contact with, everyone that they influence. And so it's really incredible that we get to do that, that we get to not only, work with our client, but also everybody whose lives they touch too. We'll never really know how far reaching that goes.
Wonderful. Right. Is there anything that we have not mentioned that you would like to say before we close?
I think just talking about our post-conference training, Cormac, do you want to
yeah,
share
you're
a little
allowed
bit
to say
about
that. Anybody who comes onto the show is allowed to promote their thing. So go ahead.
So we are running training in Chicago in the days after the Chicago conference. So will we see you in Chicago, Astrid?
You will. Yes, I'm speaking as well on tinnitus, of course, or tinnitus.
Yes. So we're doing the Tuesday to Friday following the conference,
Wow,
running
3
training.
days.
Yeah.
Yeah.
And so we've had a lot of excitement about it. We've lots of people signed up. It's delivered online, but also if anyone is in Chicago, they can join us live for the training. We can, Jodie, do you want to put in the link there if anyone wants to look at it?
Oh yeah, absolutely. And Astrid, I know when you put this out, you'll drop the link to the
I will do,
conference.
yes.
And we're
Definitely will.
on there as an official post-conference training, so they can check that out.
Okay. Yeah, we'll do that. Okay, wonderful. No, it's 4 days. I just said 3 days, but it's 4-day training, right?
4-day training.
Oh,
Yeah.
Tuesday till Friday. Yes, that's 4 days. All right, wonderful. So, thank you so much, Jodie and Cormac, for joining us tonight and telling us about the protocol. I think we've had some comments about nice tidbits and lovely information that you've given us. And I will see you at the Chicago Mid-America Conference. Don't have to get them confused here. On October 17th to the 19th will be the conference itself. If you would like to get a ticket, check the show notes or the comments for the website. And I will also put the website on for Jodie's and Cormac's training if you are there in person or online. Both is okay, as I hear.